All right, let's dive into one of the most incredible organs in the entire human body, the liver. We're going on a journey to explore its almost magical ability to grow back and the really high-stakes world of liver transplantation. It's going to be a fascinating ride. You know, the liver is an absolute workhorse. It does so much for us. But when it starts to fail, it doesn't always play by the rules. In fact, it can create some of the most mind-bending puzzles in all of medicine, leaving even experienced doctors scratching their heads. So, to kick things off, let's look at three of these mysteries. These really show just how strange and complicated things can get when the body's main filter starts to break down. Okay, check this out. It shows just how smart our bodies can be. When the main highway for blood coming into the liver, that's the portal vein, gets blocked up by a clot, the body doesn't just give up. No way. It starts building its own detour, this whole tangled network of new little vessels. It's called cavernous transformation, a natural bypass. The only catch? It's a slow construction project. It can take a full year to complete. Our second mystery is a real case of mistaken identity. It's a wild one. When treated breast cancer spreads or metastasizes to the liver, it can do something really weird. It can actually change the shape of the liver, making it look for all the world like it has cirrhosis. But here's the puzzle. Other types of cancer that spread to the liver, they don't do this. Why breast cancer cells are able to pull off this perfect disguise is still a complete mystery. And for our last puzzle, we have cryptogenic cirrhosis. The name itself is a giveaway. It means it has an obscure origin. This is a diagnosis when a liver is scarred and failing, but doctors can't point to the usual suspects, like alcohol or hepatitis. Now, we think a lot of these cases might be tied to fatty liver disease, but for so many people, the cause is just unknown. And that often leaves them with only one very dramatic solution. So when you have these baffling end-stage diseases, what's the answer? Well, for a lot of people, it's the modern miracle of liver transplantation. It is, quite literally, a second chance at life. And this is all possible because the liver has a genuine superpower, regeneration. I mean, think about this. A living person can donate just a piece of their liver, and that donated piece can double in size in as little as 3 weeks. It's phenomenal. That single ability is what makes live donor transplants such an incredible success story. So who are the people who need this incredible surgery? Well, the data shows that the #1 cause is damage from hepatitis C. That's followed by alcoholic liver disease, and then comes that mystery condition we just talked about, cryptogenic cirrhosis. Now, the surgery itself is, of course, unbelievably complex, but you can really boil it all down to making 4 crucial connections. Think of it like a plumbing job. The surgeons have to hook up the main vein going out, the IVC, the main vein coming in, the portal vein, the main artery, the hepatic artery, and finally, the little pipe that drains bile, the common bile duct. But, you know, not everyone can get a transplant. There are some absolute no's, like if cancer has spread outside the liver, or if someone has really severe heart or lung disease. But what's also interesting is what isn't an absolute deal breaker. For example, portal hypertension, that's really high pressure in the portal vein, makes the surgery way harder, but it doesn't automatically take you off the list. Okay, so the new liver is in. Everything's great, right? Well, not so fast. Because as soon as that new organ is in place, the entire rulebook on how it gets its blood supply gets thrown out the window. See, in a normal healthy liver, like the one you've got right now, about 70% of its blood comes from the portal vein. That's the big vessel bringing in all the nutrient-rich blood from your gut. The hepatic artery is kind of a supporting actor, chipping in the other 30%. But in a transplanted liver, you can just forget all of that. The game has changed completely. There's a new star of the show. After a transplant, the hepatic artery becomes the absolute VIP. It's the lifeline. Why? Because during the surgery, all the tiny backup vessels get cut, so the artery is now the only source of blood for the very delicate bile ducts. If that one artery fails, if it gets a clot, the bile ducts start to die. It's a condition called necrosis. So everything depends on that one artery. So how on earth do doctors keep an eye on this one critical lifeline? They can't just look at it. Instead, they listen. They use a Doppler ultrasound, which turns the sound of blood flow into a wave pattern they can see on a screen. And this shows you exactly what they're looking for. A healthy artery has this nice, sharp, spiky waveform. But if a clot starts to form, you can see that signal break down. First, the flow when the heart is relaxed just disappears. Then, the main peak from the heart's big squeeze gets weak and rounded out. That's a dreaded sign called tardus parvus. And finally, stage 4, there's just silence. The waveform is completely gone.
So doctors have this kind of cheat sheet, a set of numbers that tells them if the artery is healthy. The systolic upstroke, how fast that wave shoots up, needs to be quicker than 80 milliseconds. The resistive index, which measures downstream pressure, should be between 0.5 and 0.7, and the top speed of the blood flow should be under 200 centimeters per second. These are the vital signs of the new liver's lifeline.
And, just to add another layer of complexity, that weak, dampened tardus parvus waveform doesn't always mean there's a clot or thrombosis. It can also be a sign of stenosis, which is just a narrowing of the artery. Figuring out which one it is, well, that's a huge challenge for the doctors.
So let's just pull it all together. We've gone from these baffling diseases that stump doctors to an incredible life-saving surgery made possible by the liver's ability to regenerate, all the way to this post-op world where the patient's entire future depends on listening to the sound of blood flowing through a single critical artery.
It's really amazing when you think about it. And it leaves you with one final big question. If we can already use sound waves to tell the difference between life and death inside an organ, what's next? What's the next frontier going to be in being able to see inside the human body